My name is Brooke, and I was a competitive figure skater for 12 years. Figure skaters' determination, athleticism, and work ethic cannot be overstated. Like most figure skaters, I started training at the age of 2. Figure skating puts a lot of demand on the body, both physically and mentally. Through undeniable grit, dedication, and hundreds, if not thousands of hours on the ice. These athletes are able to jump over 24 inches in the air, completing up to 4 revolutions in well under a second, landing on a 4mm blade and absorbing a force up to 12 times their body weight. Due to the competitive nature and rigorous training methods required, these athletes experience a fair share of both acute and chronic overuse injuries. So what are some injury prevention strategies for lower extremity injuries in figure skating? To start off, I'm going to go through the difference between traumatic acute injuries and chronic overuse injuries. Traumatic injuries are severe with a sudden onset. Examples in figure skating include ankle sprains and fractures, dislocation of the patella or shoulder, ACL and meniscal tears, head injury and concussions, labral tears of the hip and lacerations, whereas chronic overuse injuries can be a result of injuries not properly healing, creating muscle imbalances such as weakness or tightness. Some overuse injuries in figure skating include stress fractures in the foot or spine, stress reaction, example shin splints and medial tibial stress syndrome, tendinitis of the Achilles, patella or peroneal muscle, muscle strains of the hip, jumper's knee or patellofemoral syndrome, apophysitis, os-good slatters in the knee or iliac crest in the hip, bursitis in the ankle, and lace bite. About half of all injuries are caused by overuse and are preventable. Single skaters have a higher incidence of overuse injuries, while pair skaters and ice dancers are more prone to traumatic injuries. Now I'm going to go through some of the more common chronic overuse injuries in the foot and ankle. First common overuse injury in the ankle is Achilles tendinitis. So this consists of the gastrocnemius complex, which contains the gastrocnemius and the soleus calf muscles, and they share the Achilles tendon, and they insert on the base of the calcaneus, so the heel bone. Signs and symptoms of Achilles tendinitis include pain during physical activities or at rest, inflammation, swelling, and thickening of the tendon. Mechanisms of injury include overuse, poorly fitted shoes, and eccentric loading. Jumping and running are common causes of Achilles tendinitis, and specifically, figure skaters may develop Achilles tendinitis because of overtraining, repetitive jumping, and pressure exerted from the top of the boot. Achilles tenosynovitis is another common injury to the Achilles tendon experienced by figure skaters. It is an overuse injury which affects the sheath surrounding the Achilles tendon, rather than tendinitis, which is the degeneration of the tendon itself. The covering of the Achilles tendon is called the tenosynovium, a fluid-like sheath surrounding the tendon so that it can slide under the skin. Constant rubbing and pressure from the boot can irritate the tendon synovium, leading to tenosynovitis. Symptoms of Achilles tenosynovitis include pain in the Achilles tendon. The Achilles tendon will be painful to touch. Pushing up onto tiptoes or stretching the calf muscles may cause pain in the Achilles tendon, and the tendon may appear swollen or thickened, and a creaking sensation called crepitus may be felt when moving the ankle. Once a figure skater develops Achilles tenosynovitis, the problem can be difficult to resolve because the tenosynovium remains sensitive to the pressure from the boot. Figure skaters may also suffer from stress fractures due to overuse, such as repeatedly practicing the same jumping skill. Stress fractures can occur to the metatarsals, the long bones of the foot between the phalanges and the tarsals. Any metatarsal may experience a stress fracture but occur most commonly to the first and second metatarsal, the fourth and the fifth metatarsals, and in the tarsal navicular. The mechanism of injury is on loop, flip, or lutz jumps. The navicular is usually overloaded on the takeoff foot. Additional risk factors for metatarsal stress fractures include any combination of the following: sudden increases in intensity or duration of activity, decreases in the amount of rest and recovery, changes in training surfaces, changes in footwear, inadequate nutrition, low bone mass, and length differences between the first and the second metatarsals. Now I'm going to go over some of the common chronic overuse knee injuries. The next common overuse injury in the knee is patellofemoral syndrome, which is characterized by a dull aching pain in the front of the knee and is defined as pain in the knee region that is provoked or attenuated by actions that involve motion at the patellofemoral joint and or increased pressure of the patella against the femoral condyles. This injury occurs over time, and many figure skaters do not even know that they have it until their knee hurts so badly it interferes with their skating. Repeated jumping often causes this condition. The most common symptoms include pain around the kneecap, pain experienced during squatting or bending, or sitting for extended periods of time with your leg bent at a 90-degree angle. Patellofemoral syndrome is common in teenagers and flat-footed athletes. Improper warm-ups and cool-downs can aggravate this condition as well. However, the most common reason skaters get patellofemoral syndrome is due to inadequate lower body and core strength. As evident by the video of me in the right corner, this next overuse injury is common in children and adolescents. So this overuse injury is called Osgood-Schlatter disease, and it causes a painful lump between the kneecap in children and adolescents experiencing growth spurts during puberty. Osgood-Schlatter disease is common in children who participate in sports involving jumping and running such as figure skating, basketball, and ballet. Boys are more affected by Osgood-Schlatter disease than girls. However, that gap is narrowing as more girls are participating in organized sport. Symptoms of Osgood-Schlatter disease include swelling, pain, and tenderness of the bony prominence on the tibia just below the kneecap on the tibial tubercle. So the question is, what are some injury prevention strategies for lower extremity injuries in figure skating? Some strategies to help prevent injuries and adequately perform the movements of the sport is to incorporate an off-ice strengthening program into their training routine. This off-ice training program should focus on trunk strengthening and stability, lower extremity strength, balance, and power exercises. Furthermore, some important components to include in an off-ice training program is inhibitory techniques such as self-myofascial release, integrated dynamic movements, isolated strengthening exercises, balancing exercises, kinetic chain exercises, plyometric exercises, and static stretching. The next few slides will go more in depth about the important components of an off-ice training program, and I will also outline an example of an off-ice training program that can be used for figure skaters to help prevent injuries to the lower extremities. With an off-ice training program, it is important to include a warm-up. Jumping rope is an excellent activity for figure skaters. It not only brings the heart rate up and warms up those jumping muscles, but it helps with other things like strengthening and alignment, as well as rhythm, coordination, and timing. When I figure skated, I always had a jump rope in my bag, and I would jump rope for 2 to 5 minutes to help warm up my muscles before I went on the ice. Also, another helpful tip with jumping rope off ice is to jump rope for the same time you would skate your routine on the ice. So if your routine is 4 minutes long, you should jump rope for 4 minutes straight. This helps with your cardiovascular fitness and stamina on the ice when you skate through your 4-minute routine. Techniques such as self-myofascial release should be used to decrease tension and effects of trigger points due to overactive muscles surrounding the affected area and adjacent segments. Self-myofascial release also improves joint range of motion and mobility, which can contribute to increased strength and speed on the ice. The importance of self-myofascial release is to reduce inflammation and strain on the soft tissues, while also enhancing body awareness and promoting faster post-exercise recovery. Here, I outlined some self-myofascial exercise examples that would be effective for figure skaters because it targets the muscles that are specifically overworked on the ice. such as the gastrocnemius/soleus, biceps femoris, peroneal muscles, and the TFL/IT band. I recommend that you perform at least one set of these foam rolling exercises for a duration of 30 to 60 seconds, focusing on that point of tension. By implementing foam rolling into your off-ice training, this will decrease some of that muscle tension and prevent any further injuries to the lower extremities. Dynamic stretches are an important component to include in an off-ice training program because they put your muscles through short, quick movements. This helps prepare your muscles for the rapid contractions that occur while skating on the ice. An important note while performing dynamic stretches is to move through the range of motion, keeping control of the movement with your muscle. Do not allow momentum to control the movement by flinging or throwing your body parts. The first dynamic stretch I outlined in this training program is walking lunges, which helps increase range of motion and flexibility in the hips and hamstrings. This exercise activates several muscles including the quadriceps, hamstrings, glutes, gastrocnemius, and abdominals. The next dynamic stretch is side-to-side lunges, which are beneficial because they help develop balance, stability, and strength, which is a crucial component of figure skating. This exercise activates the quadriceps, glutes, and hamstrings. The next dynamic stretch is side leg swings, and this exercise is beneficial because it warms up and stretches the hip muscles and hip joint. The exercise therefore activates the glutes and hip flexor muscles. The next dynamic stretch is trunk rotations, and the trunk muscles play a vital role in any motion the body performs. Improving trunk mobility helps to improve overall balance and body stability, which is crucial to help prevent injuries to the lower extremities. Therefore, the muscles this exercise activates is the rectus abdominis, transverse abdominis, and obliques. The last dynamic stretch is ankle rolls, and this is beneficial because it increases range of motion and flexibility in your ankles, and it also builds up supporting muscles that keep you balanced. The muscles activated while performing this exercise is the peroneus longus, peroneus brevis, and extensor digitorum. The recommended outline sets and reps for each exercise is 2 sets with 12 reps of each exercise, alternating each leg and performing the exercise to each leg/foot where needed. Isolated strengthening exercises should be used to facilitate identified underactive muscles. For an athlete who specifically struggles with foot or ankle dysfunction, restoring adequate ankle dorsiflexion is paramount. Other exercises should be incorporated to strengthen the musculotendinous structures of the foot and improve proprioception. Here in this program design, I included a resisted ankle dorsiflexion exercise using a resistance band. I would recommend using a light to medium resistance band for this exercise, however it depends on the athlete and whether they have undergone a previous ankle injury. Once you have your resistance band, you can secure it to a fixed point. Then, as the video shows, you're going to dorsiflex your ankle towards you. The muscles strengthened in this exercise include the tibialis anterior, extensor hallucis longus, and extensor digitorum longus. The next exercise outlined is a resisted ankle plantar flexion and inversion exercise. This exercise specifically strengthens the posterior tibialis muscle. I recommend performing 2 sets of 15 reps of each of these exercises, while performing the exercise on each foot. This next isolated strengthening exercise outlined is resisted ankle eversion, which is the opposite movement of the previous exercise I just mentioned. The muscles strengthened in this exercise include the peroneus longus and peroneus brevis muscle. Strengthening your muscle everters are important because this can help prevent ankle strains or help treat ankle instability. I recommend performing 2 sets of 15 reps of this exercise using a light to medium resistance band, switching the foot each time. The next exercise outlined is a standing calf raise on an elevated surface. This exercise specifically strengthens the muscles in the calves, such as the gastrocnemius, soleus, and tibialis posterior. This exercise improves overall ankle muscle strength and stability, which helps prevent injuries to the lower extremities. I recommend performing 2 sets of 15 reps of this exercise on an elevated surface. The next isolated strengthening exercise is single leg glute bridges. Strengthening the gluteus maximus and gluteus medius helps reduce internal rotation of the femur, which means it will prevent your knees from coming across the midline of the body. Example is knee valgus. This is especially important when it comes to the landing of jumps on the ice. The single leg glute bridges exercise specifically strengthens the gluteus maximus, gluteus medius, and hamstring muscles. I recommend performing 2 sets of 15 reps, switching the leg that raises in the air each time. The next isolated strengthening exercise is a prone plank. Strengthening the abdominal muscles helps to provide stabilization, balance, and good posture, which are essential for figure skaters. The strength and stability of the core affects the movements of the entire body and limbs. Everything works as a kinetic chain, and it is crucial to have strong abdominals in order to prevent injuries to the lower limbs of the body. The prone plank exercise strengthens the transverse abdominis, rectus abdominis, internal and external obliques. I recommend doing 2 sets of 30-second hold planks. Incorporation of balance and proprioceptive training is imperative to reduce injury risk and enhance kinetic chain performance at the knee, hip, and lower back. With the base of support reduced by skate blade design, the athlete continually seeks synchronization in the muscular recruitment and balance from the medial lateral muscles of the hips, knee, and ankle. The first exercise I outlined here is a multiplanar single-leg balance reach. This exercise specifically works on balance while eliminating muscle imbalances by strengthening the glutes, hip abductors, hip adductors, hip flexors, hip extensors, and abdominals. The gastrocnemius and soleus work as stabilizers for this exercise. I recommend performing 2 sets of this exercise on each foot for a duration of 30 seconds. The second exercise I outlined is a single leg spiral on a Bosu ball. A spiral is a movement performed in figure skating, and it requires a lot of balance. Therefore, performing this movement off ice on a Bosu ball, this helps the user coordinate muscles and nerves for unstable conditions, which will aid in preventing injuries on the ice. This exercise will strengthen the gluteus maximus, gluteus medius, hamstring synergy, transverse abdominis, and multifidus. The gastrocnemius and soleus muscle will work as stabilizers. I recommend performing 2 sets of this exercise on each foot, holding for a duration of 30 seconds each time. Figure skaters demand enhanced power, specifically in jumping and for speed necessary to complete technical skills. For the skater to perform multiple jump rotations, the athlete must explode into the takeoff and landing with faster rotation, not necessarily height production. Therefore, the first plyometric exercise I outlined here is 180 jumps. 180 jumps fully engage your lower body and core and help build strength, speed, and aerobic fitness. Figure skaters perform rotational jumps on the ice. Therefore, practicing the rotational movement off the ice helps improve power exerted by the muscle in the lower extremities. The muscles used in this exercise include the gastrocnemius, hamstrings, quadriceps, abdominals, glutes, and hip flexors. I recommend performing 2 sets of 15 reps of this exercise. The second plyometric exercise I outlined is lateral skater jumps. This exercise increases the coordination between the torso and the legs, and it helps stabilizing the hip, knees, and feet joints. This exercise also promotes agility and weight transfer while we alternate from one foot to the other, creating the motion of a skating stride. The muscles used in this exercise include quadriceps, hamstrings, gluteus medius, hip abductors, and hip adductors, and the gastrocnemius. I recommend performing 2 sets of 20 reps of this exercise. Static stretching should be performed for a minimum of 30 to 60 seconds on an identified overactive muscle to help facilitate optimal joint range of motion and muscle extensibility. Static stretches include long, slow holds, which are more useful to improve your overall flexibility and are more effective if done after practice or an off-ice training session as a cool down. Here I just outlined some static stretches to include in the off-ice training program as a cool down. The first static stretch is a calf wall stretch, and this specifically targets the overactive gastrocnemius muscle. The second static stretch is a lying hamstring stretch, which specifically targets the overactive hamstring muscle. The next static stretch is a standing single leg quadriceps stretch, which specifically targets the overactive quad muscles. The next static stretch is one for the TFL and IT band muscles. Lastly, the last static stretch is a Kolbe stretch, which stretches out multiple muscles in the body, such as the latissimus dorsi, erector spinae, trapezius, gluteal muscles, abdominal muscles, quadriceps, deltoids, and biceps. In summary, this recommended off-ice training program specifically focuses on lower limb strengthening, trunk strengthening and stability, balance, and power exercises, which are essential attributes required by competitive figure skaters. However, a strength and conditioning program must be individualized to the athlete based on identified movement pattern inequalities and strength deficiencies. Progressions should be implemented as the athlete accommodates to the tolerable load with absence of compensatory movements to avoid injury and achieve maximum performance.